Hello, my name is Tejon Bailey Deslandes,
My name is Negus Luke.
And my name is Menelik Luke.
and we'll be talking about treating rheumatoid arthritis with regulatory T cells, or Treg cells for short, that have been genetically modified. What is rheumatoid arthritis? Rheumatoid arthritis is an autoimmune and inflammatory disease. What happens is the body's immune system will mistakenly send antibodies to the tissue lining your joints, where they will attack the healthy cells there. The resulting inflammation will cause painful swelling mainly in the joints. It is also worth mentioning that most patients who have this disorder are between 30 and 50 years old. That is over 1 billion individuals who potentially have it.
How will rheumatoid arthritis be cured with Treg cells? The genetically modified Treg cells will inhibit effector T cells, such as cytotoxic T cells, T helper cells, and other Treg cells, and antigen-presenting cells, such as dendritic cells, from functioning and maturing. As you see right here in this photo on the left, this person will get the genetically modified Treg cells injected into them, which will lead to 5 different things happening. Firstly, the inhibition of DC function. This is when the Treg cells interact with DC, disrupting DC maturation and inhibiting TF activation. Secondly, cytolysis. The secretion of granzymes and perforin induces apoptosis in TF cells. Thirdly, the consumption of IL-2. This is when the Treg cells starve TF cells of IL-2 signaling. Fourthly, metabolic disruption. This is when Treg cells produce adenosine, which inhibits TF cells' response. And lastly, inhibitory cytokines. Secretion of anti-inflammatory cytokines suppresses Th1, Th17, and APC activity. And voila, the patient is cured.
What application of biotechnology in immunology was used to identify rheumatoid arthritis in patients? The biotechnology technique known as enzyme-linked immunosorbent assay, ELISA, was used to detect the self-antibodies that attack normal cells around the joints that cause rheumatoid arthritis in the scholarly article that we chose. First, the blood sample is taken from the patient. There are 3 types of ELISA. The one we will be looking at is the indirect method, where antigens are stuck on the bottom of a plastic surface, and the antibodies from the disease we are testing for will bind to the antigens. Any other antibodies that are not of interest will be washed away. A second antibody will come with a marker which will change the color of the solution when an appropriate substrate binds to it, indicating a positive test for an individual having rheumatoid arthritis.
Conclusion. Even though most autoimmune disorders like rheumatoid arthritis only affect a small portion of the population, they still need to be treated.
And genetically modified Treg cells are necessary to treat multiple autoimmune disorders that have no cure.
Using these genetically modified regulatory T cells to treat autoimmune diseases will give rise to new methods to cure these disorders in the future.
And here are our references. Thank you.
Thanks for listening.